Hi, I'm Dr. Bianchi. This is BJ, and I'm your Oklahoma veterinarian.
Hi.
Hi, Brooke.
How are you, Dr. Bianchi?
Doing well. How do you have today?
This is BJ.
BJ?
And
He's a stallion too, huh?
he is. He is a stallion.
He's a pretty good boy.
He is a very good boy. He's fun to
Well, some of the drugs I use, the sedatives that I use, have some cardiac potential of slowing down the heart or causing AV blockages, which is a blockage in the electrical conduit of the beating. And so I want to make sure that we don't have any arrhythmias or any other problems that might be present that may be influenced by the sedation I use. So,
Okay. Good boy.
it lies really close to the carotid artery, so if it goes into an artery, that'll bring the drug to the brain too quickly. So that's a big concern of using
That's
injectable.
scary.
Not to worry. I've done many of these.
How long does the sedation last usually?
Oh, it'll last for about 2 hours. I'm going to reverse them when I'm finished with the procedure here. I'm getting rid of breakfast here. Horses tend to keep a little bit of food in their cheeks. Lower teeth next to the tongue have the sharp enamel points. He's got a nice level arcade going on here. And then the upper teeth, you can see some points there near his cheeks. Okay.
So that might cause some irritation?
Yep, that's what he's reacting to when I was palpating outside of his cheeks. Right there where that little laser dot is, he's got some abrasions where he's biting himself, so he's got a little soreness in his mouth. Next to the edge of the gum line, you can see sharp points. Here in his lower teeth, he's got some sharp points next to his tongue. Trying to pick some food material out of here, and I'm evaluating his gum lines here. Make sure he doesn't have any gingivitis or anything else that might be. The tool I use is like an electric toothbrush. It just vibrates back and forth at a high rate of speed, and I guide it with my hand. There's no chance of thermal injury because my hand's in there. If it was creating too much heat to kill the tooth tissue, well then I would feel it and I would burn myself as well. So to me, this system seems to be the best system out there. It mimics the old-fashioned method of using your hands to go back and forth.
Okay.
Take your thumb and turn your hand this way and push the cheek of the cheek away from the upper molars and feel alongside the outside edge there.
Oh, wow. Feels smoother now.
And now take your finger to the other side, which I haven't done yet, and push the cheeks away and rub on the outside of that. See how sharp those are?
Jagged.
Yeah.
Much smoother on the right side. Wow, it's a big difference.
Yep, and I think you'll see a big difference too when you get into the show ring with him. And he probably won't drop as much feet because he was using his feet to push the cheeks. Opening up the pulp of the tooth and allowing infections to occur and killing the tooth essentially, and you wouldn't know about it for a couple of years, maybe even 5 years down the road. So yes, you can take off too much enamel.
And is it painful?
Yes, of course it is, because the pulp cavity is exposed, the nerve's exposed, and they can feel that as they eat. So
Is there a chance of infection when that's done?
there is. As you can see, there's quite a bit of difference now
Wow, it's much smoother.
with the teeth here. Which is basically smoothing the first front premolars. So that when your hands pull in a range and the bit comes into the mouth, See how nice and smooth that is right there?
So the bit sits against that tooth
Yep,
there?
as the bit's pulled in, the lips are pulled into these points. So we smooth them down and allow the horse to be more comfortable. Okay, with that done, we're going to take the speculum out and we're going to work on the important part of the teeth, which is the front part. So right now his incisors have more contact than his molars do at this point. So what I'm going to do is I'm going to float these incisors down a little bit more so the molars come into contact. That way there won't be so much pressure on his temporomandibular joint here in the back. That's very important that these incisors are dressed up. So he does have a little bit of tartar here on this corner incisor and on the canine teeth here, and we'll clean those up as well. You don't want to take too much off the incisors because then it puts the load on the molars all the time, and that's kind of painful. So take a little off each time, and you do it by feel. Now I can feel his molars occluding. And we got just a little bit of a gap with his incisors here. They're nice and level. Good lateral excursion. He should be more comfortable with his temporomandibular joint now. Okay, now we're pretty much done with this, Brooke. We're going to reverse BJ here. Should take about 2 or 3 minutes. And he should be about 90% of what he was right before he walked in here.